Good day, folks. This is Mike Corrigan, formulator, educator, and master herbalist for LifeSeasons. So the whole idea of what we're talking about here again is another one of those age-related problems. And this particular one actually has age relationship in the name, and that's age-related macular degeneration. It gets to be almost an epidemic situation in the country for folks over age 60. Degeneration can also take many forms, and one of the items that keeps many ophthalmologists in business is the removal of cataracts, which I used to travel with an old naturopath that claimed that it was entirely possible to have cataracts literally removed. The body would remove them, but I have never experienced that myself, and consequently we're going to try and avoid the surgery altogether by utilizing a list of nutrients here, some phytochemicals, some phytomedicines, some nutritional supplements that are all geared towards eye health. There's a few causes other than age. One of those, if you're busy out there lighting up, you might want to put that out, because smoking is the next to age as far as the most causative factor in AMD or cataracts. Diabetes happens to be another, which we have talked about with our Diabetic product here, and in fact those two products could go hand in hand, could be taken at the same time. That's just because the nutritional amounts that are necessary both in diabetes and in these age-related problems with macular degeneration. Infections tend to be a problem, especially eye infections. Repeated eye infections tend to damage the tissue and set it up for failure later on. And then we have a dietary lack of free radical scavengers, specifically eating the colors. We've talked a little bit about those, but the ones that are most specific to the eye are those that are the yellow, oranges, and reds. Actually, there's a little bit of blue-purple in there as well, which we'll talk about in a minute with relationship to bilberry. Eye injury, blow to the eye, or scratches on the surface of the eye. And then last but not least, abnormal long-term adrenal corticosteroid or hormone treatment. So all of those things tend to set you up for failure in the area of macular degeneration and cataracts, or a variety of different eye-related conditions of poor vision. Items that we would most like you to take on a supplemental basis are items that happen to be in the formula as well. You may want to consider taking a little bit of extras simply because of the amount that's necessary. Vitamin C should be taken in a usable form. Calcium polyascorbate, ascorbic acid from natural sources, or vitamin C with a set of bioflavonoids in them would be a very good choice here. A minimum of 500 milligrams daily would be advisable. Vitamin E, again a natural source vitamin E, between 400 and 800 international units per day. I prefer the oil-soluble variety, especially where we're dealing with an oil-soluble format in the eye. Provitamin A or beta-carotene, 25,000 international units. And last but not least, zinc. And I need you to pay attention to this because the amount is fairly high comparative to what you'd find in a typical multivitamin, and that would be 80 milligrams per day. So take that into consideration. Make sure that your multivitamin has sufficient amounts of those, and then it would be very worthwhile for you in order to do a little bit better job of prevention to take them on a long-term basis. We need to talk here a little bit about diet, simply because the compounds that we're talking about here are products that have an ability to be supplemented, but you'd be very wise to take them in on a fresh basis, simply because of the oxidation that tends to take place with fresh vegetables, fruits, and so forth. In fact, it's a well-known scientific experiment that you can take a cantaloupe, or you can take berries and so forth, and you can cut them, and within a 3 to 4 hour period of time, you've lost better than half of the vitamin C, specifically, in that fresh fruit or melon. So dietarily, we're going to go with green leafy vegetables. I have to go back way back when I used to travel around the country with the late great Dr. Christopher, who generally was a big fan of grains, nuts, seeds, and basically whole green leafy vegetables. as often as you could get them. In fact, he was of the opinion that you should eat about 40% of your diet raw, which in these days, very difficult to do, hence the supplementation becomes an option. Need to get some chlorophyll-rich items in there, as well as the zeaxanthins and the luteins and so forth that come along with the leafy vegetables. Next, you need to find a good essential fatty acid source, specifically O3s for the eye, omega-3 essential fatty acids. DHA and EPA are both very, very worthwhile and critical for eye health and the circulatory pathways of and to the eyes themselves. I would recommend that you get an enteric-coated fish oil product, simply because you're going to be a lot more efficient with it, and you're not going to have to worry about the burp back that comes from high intake of fish oil. Botanicals, we're going to go back to two of my very favorites that we've talked a little bit about here in some of the other formulas. In this particular case, we have bilberry again, Myrto Select, which is a product that comes all the way from Italy, and a company there by the name of Indina. Indina is literally to ginkgo actually literally to bilberry what the world has come to know as the leading, literally patented product in bilberry extract. The folks there have done some tremendous research on a lot of different things, all the way from macular degeneration to night blindness. The bilberry has a compound in it known as actually visual or macular purple in the organelle of the eye that's responsible for night blindness, and it just so happens that, of course, bilberry's pigment is purple, blue purple, and it's in the outside covering of the bilberry fruit itself, and we call that the doctrine of signatures. That color tends to show us exactly where in the body it's going to work. Ginkgo actually is very similar to that, in that if you were to take a cross-section of the back of your head, lay it out in a fan-shaped motion, you'd see that it literally has the exact shape of a ginkgo leaf, which is where the Chinese got the idea that it was going to be good for brain and brain circulation in the first place. They also utilized it for a variety of different bilobed organs, including the lungs, and they actually used ginkgo to treat asthma at one point in time. So you've got lots and lots of botanical doctrine of signatures at work here for you. It's kind of fun to be able to not only talk about the science, but to impart some of the really interesting things that that the plant kingdom gives us from a kind of human interest point of view as well. One of my favorite things. Last but not least, we've kind of done this a little bit backwards from what we have done in the past. We talked a little bit about the key ingredients first, and then went to some of the other items. This time we've flipped that around on you a little bit, and we're going to talk basically about the three most effective compounds in this particular formula, listed as lutein, lycopene, and zeaxanthin. Now, all three of these are carotenoids. The lycopene product is literally a red carotenoid, whereas the lutein is basically orange-yellow, and the zeaxanthin is yellow as well, a yellow pigmentation product. Very interesting that both of them, lutein and so forth, have to do with the yellow pigmentation at the back of the eye that, in this particular case, is responsible, in lutein's case, for fine vision. So it's extremely difficult when AMD starts to attack that area to be able to concentrate and focus on very small, very fine products. Zeaxanthin, on the other hand, is primarily the yellow pigment of the retina, and this particular item has some very interesting principles associated with it from an antioxidant standpoint. It was originally named for a yellow pigment that was isolated in Zea mays. Of course, that's the old botanical name for corn, and it's retained that name ever since, and we call it zeaxanthin because it is yellow. You have to understand that these things have to be eaten. They are items that the body has to take in from a food source basis. Low plasma levels of zeaxanthin greatly increase our risk of AMD. A 2007 study from the National Eye Institute showed that if we were to raise our serum cholesterol of zeaxanthin, that our ability to control AMD and cataracts would decrease. Well, folks, I hope that like me, you're interested in a product like this as I approach my 61st birthday, and I start thinking about the fact that it'd be a lot more fun to see the world as I am seeing it now than having to deal with the serious vision impairment. I think it'd be well worth it for you to check this product out, and if in fact you're in that category of age-related illnesses, or if you've got some genetic disposition to it, give this a try. Nutrition is my first line of defense. Thank you.